She's an MD from the Czech, and she also has, she's a naturopath. What I can tell you is that she's changing lives. There's a lot of people in this room that have taken part in her cleanse programs and supplements and all that kind of stuff. She does a lot of great things out of her office, like, is it called chelation? Chelation, ozone therapy, and IVs that are specifically tailored to you and the supplements that you need and that sort of thing. So she's doing amazing stuff, and we're glad she's here. So please welcome Dr. Katka.
Hello! Yay, thank you for the introduction. Welcome everyone. So yes, today will be our final series for the year, but we'll resume next year. Who knows what we're talking about tonight? Yes, yes. And the beautiful thing about the endocrine system, there's so many glands that actually do create the whole endocrine system. And it's one of the systems that I feel has been so scattered in our medicine. You know, if you've been to any of my previous talk, who has been to the liver talk or the pancreas talk? Anybody? Okay, great. So you'll know what I really love to do is connect the dots. That our body works as a whole. It doesn't work as one organ over here doing all the work, and then, you know, the liver over here and the pancreas over here. It works together. And the endocrine system, all the glands are connected. So let's talk a little bit about that. We'll start with a brief overview of all the endocrine glands, and then we'll focus on some of them because, as you know, the thyroid is a big one. We all know about hypothyroid. The adrenals are another one. And definitely for all the women here, we'll talk about the estrogen, the progesterone, and the question about, do we need the hormone replacement or do we not? What is our body actually asking for? So let's start with a little introduction. That's going to be for later. Don't look. Going to be actually surprised how beautifully all that works. So there are two kind of master glands. The hypothalamus is all the way in the brain, and it regulates the whole endocrine system, and that is the connection between the nervous system and the endocrine system. If you think about the body, I always like to think in hierarchies, you know, so the nervous system is on the top, kind of regulates everything below. The endocrine is right there. So the nervous system, the endocrine, and the immune system, and there are all the other organs kind of fall underneath. But the hypothalamus gets the messages from pretty much how we feel, how our environment is, you know, any pain response to food, and it gets it via blood, and of course nervous impulses, and it sends messages to the pituitary. We've all heard about the pituitary. It is the master gland, and it actually is. We forget a lot about the pituitary in traditional medicine, you know, unless there is a tumor and it's producing too much of certain hormone, or it's being absolutely depleted and it's not producing any, we don't pay any attention, and we really have to. And here's why. Because it regulates all the other glands underneath it. So what's underneath is the thyroid, the famous thyroid. Then we have the adrenals. Then for women are the ovaries, and for men it'll be the testes. With the thyroid, there are these four tiny little glands that are called the parathyroid that actually regulate the calcium metabolism, which are very important. And often when surgeries get done for thyroid, they get removed. Not really by accident, it's kind of hard to leave them behind, so they get removed, so it creates a lot of problems, not only with thyroid not being there, but with actually calcium metabolism. So those are very important. They produce parathyroid hormone. Those are kind of the basics. And then, as you know, if you've been here, we talked a lot about the pancreas. So we probably will not talk much about the insulin in the pancreas, but that one is definitely a part of the endocrine system. And then there is a tiny little gland in the back of our brain that produces melatonin. Anybody want to guess? The pineal gland. The pineal gland is quite a magical gland. You might have heard a lot being here at Storm Wisdom that not only does it produce melatonin, it is very important for sleep in the day and night cycle. It actually, melatonin is used also as an anti-cancer therapy. A very high dose is used, and it actually helps heal or treat cancer. But there are other, especially quantum physics talks a lot about the pineal gland, the way it's located in our brain. You know that we use, you know, at best they say like 18% of our brain, mostly 12, 13%. And pineal gland has, it's like that there's this activation when the pineal gland has more blood flow and is more activated, we're more connected. Like more of our brain is actually functioning, and we seem to be more connected to, I guess, the overall consciousness. So pineal gland is very untapped gland, we would say. So it's a good one. It's kind of sits in where the brain is. We probably won't spend much time on it, but it's a very important one. Then those are the basic organs of the endocrine system. And then if we take it a step further and we look at the whole body, then we will realize that a lot of other organs produce some form of hormone. So when you think about the endocrine system, the reason it is so connected is, if you think about it, I'm going to think stress or pain, right? Something I hurt myself. The hypothalamus sends signal to the pituitary immediately. The pituitary is going to send signal to the adrenals immediately. And then hormones will get released into the blood within seconds. And the whole body, because the blood circulates through the whole body, every single cell that has a receptor for a certain hormone will respond. So it's a very fast, I mean, nervous system is the fastest, right? It's the neuron. It's just like a thought, and nanosecond you already have, let's say you step on a nail, immediately you know to pick your foot. How does that happen? We don't even think about it. When we step on a nail, there is a receptor in the foot that feels pain, that sends it to the brain, right? And then the brain goes into the areas that regulate the muscles and tells all the muscles, pick up the foot, right? Happens immediately, so that's the fastest. Second one is the endocrine system. So every time a hormone attaches, or endocrine substance attaches to a receptor, it actually creates a huge cascade of reactions in the body. So it is really important to understand that there are many different kinds of hormones. Some of them are called steroid hormones, and we'll talk about them more. It's like the estrogen and the testosterone. Then there are special hormones that get produced in the thyroid. And then there are other hormones like the cortisol and like so let's actually take it kind of step back, and let's talk about one gland at a time, because there's so much to talk about. So I want to kind of slow it down a little bit so I don't overwhelm you. Are you overwhelmed yet? Getting there? Starting. Okay, so let's just take the thyroid. Okay, 200 million people worldwide, supposedly worldwide, have thyroid problems, and that's only those that went to the doctors and were diagnosed. So thyroid as a gland has been singled out a lot, because you'll go to your primary care doctor and they'll always check some thyroid results or blood work, and they'll say low thyroid. So the next step is take thyroid hormone. Right? How many of you have experienced that, or have a friend that low thyroid, you get thyroid hormone? Are you better? Are you not? Doesn't matter. We don't, the only thing we can do is thyroid hormone. So let's talk about that a little bit, because it's very important. The thyroid in and of itself is related to the whole body, because almost every single cell has a receptor for thyroid, right? Thyroid is what creates energy, increases metabolism. So every time there's a cell over here, every time thyroid hormone is actually one of those that can go straight inside the cell. It doesn't need a receptor on the cell. So there are two ways to do it for the hormones. They can either go straight in and they send a signal to the nucleus or to the DNA to start producing certain substances, and they wake up the cell in a way. So thyroid can do that for almost every single cell in the body. So what happens with the thyroid? It's very closely regulated, right? Because if it's too low or too high, it's not good. There are symptoms either way. So again, the hypothalamus regulates the pituitary with thyroid releasing hormone that tells the pituitary to produce thyroid stimulating hormone. That one then goes to the thyroid and says, we need more hormone, make more. So the thyroid goes and makes T4. I should get another color. Makes T4 and T3, and you have heard of those. Those are the basic thyroid hormones. It is very important to know that the active one is the T3, not the T4. That's why, you know, a long time ago when thyroid hormones started being prescribed, it was prescribed for the most part as armor thyroid. What armor thyroid is a natural form of thyroid that contains T4 and T3 in it. And it's kind of in that more natural state. What happened later is Synthroid came in, which is levothyroxine. So drug companies started producing just plain T4. Synthroid actually is, as I was looking, it's the 4th prescribed drug in the United States, making like millions and millions of dollars. The problem with T4 is that a lot of people, especially women, but even men, do not have the ability to convert the T4 to the active T3. So I see all the time that, you know, patients come in and they're on so much thyroid hormone and they still have symptoms. Even though they're, so what happens if we have too much thyroid hormone, it will go back to the pituitary, and via negative feedback, it'll say, slow down, we have enough, right? So we'll see on the blood work, there's plenty of thyroid hormone. There is a very low TSH because it's telling the pituitary, we don't need more hormone, but there are all these symptoms, right? Dry skin, headaches, fatigue, constipation, joint pains, even, you know, depressed mood, not feeling well, sluggish, foggy, not enough clarity. All that can be low thyroid symptom, even though there's so much thyroid hormone on board, and even though the blood work looks perfect, right? Well, the problem is that the conversion is not happening from the T4 to the T3. The T3 is the active one. So what needs to happen at that point is, if any one of you have a problem like that or know somebody, either switch from the plain Synthroid to a more natural, like armor thyroid that has both of them, or adding extra T3. And at that case, you're going to see that you can very much decrease the amount of hormone. So that's important. And then the other part is important for the thyroid is something called reverse T3. Everybody had ever thyroid tested in their lives? Probably, right? Did you have your reverse T3 tested? Have you heard of that? Okay, so what I'm going to put on here, and you have it in your notes, is it is important to test the whole thyroid, not just very often what you'll see doctors will test is only the TSH. And they'll say, okay, it's either too low or it's too high or it's okay. Well, remember, TSH is a marker of the pituitary. It's not a marker of thyroid. So we always need more. So we need a TSH. Then we need the free form of the actual hormone, because thyroid hormones are bound in the blood to proteins, and only very little of them are free, which are the active ones. So we'll need the free T3. And it's very important to take to your doctor to get it all tested. And the free T4, so we know how much of the actual active hormone we have. And it's also very good to have total T4, because we can do an equation between free T4 and total T4 and see how much we're actually converting to the free T4. Reverse T3 is very important, because what happens when the body has too much thyroid, or when there is a time of stress, or when the body kind of doesn't, you know, or we're in a place where we don't exercise, we eat a lot of food, and the body kind of needs to go kind of in that sort of hibernating place. It creates, instead of going from T3 T3 to free T3, it'll go to reverse T3. Reverse T3 is almost like a storage of T3. It's not active. Okay, so it's very important to know whether this one is low or high. So we see if somebody has symptoms and they're low here, but they're high on the reverse T3, then we know we have to help them to move the reverse T3 to the active T3, right? Instead of giving them more hormone, because they'll move it again to the non-active reverse. So this is very important to get all of those tested. If any of those are off, I always recommend to test antibodies against thyroid. It's really important, because if we have antibodies against thyroid, there's something that can be done to help to protect the thyroid. There are supplements that can be taken, there's diet that can be done, there's detoxification that can be done, so always have your antibodies tested. Okay? Any questions about the thyroid? Yes, Kathy?
All blood test?
It is all blood test. Yes, yes.
You said add T3. How would you add T3?
Oh, you can actually, compounding pharmacy, we can make a prescription for, let's say, 5 micrograms of T3, and it can be added as a separate supplement or separate medication to the T4. Yeah, T3 is broken down very fast in the body, so it has to be in sustained release form. For it, T4 kind of lasts the whole day. That's why it is prescribed so much more, because you take it once a day and you're good. So the T3 has to be in the sustained release form. Mm-hmm.
Is there like a root cause or a source that's pretty common for the thyroid to be out of balance?
Yeah, so there are a few, and that's where all the connecting dots come together. Thyroid is first of all, thyroid is very sensitive to external toxins, and then also is very sensitive to radiation, right? So everybody, not just women, but especially women, when you go and have any kind of x-rays done, whether it's mammogram, which I do not recommend, but if you go do that, or you have dental x-rays done, or any kind of x-ray, you need to ask for a thyroid protection. You know how you can actually get a protection for x-ray? It should be everybody getting it. It's unfortunately not, so we have to ask for that, but that's number one thing, so ask. The other piece is iodine. We're so not just depleted in iodine. If you think about basic table salt that just has extra iodine in it, that's not enough. It's inorganic iodine. Iodine gets so depleted today because we have so many of those chlorines and bromines. Chlorine is in everything. You don't have to even have a chlorine pool. It's all the plastic, all the polyvinyl chloride. I mean, pesticides, herbicides, everything has chlorine in it. And chlorine, same as bromine, same as iodine, they're in the same group. If you look in chemistry, at the table, they're in the same group. So, chlorine and bromine are so much stronger, they get rid of the iodine. So very often we're depleted in iodine. There is an iodine test. I really don't know how accurate it is. I have not seen it where you can put iodine on and see how long it will absorb. It is not really accurate. You can try it, but the best thing to do is you can do actually urine 24-hour iodine and see how much you have and if you need some. Or in the summer, if you're swimming a lot, just supplying a little bit of iodine really helps.
Does chlorine in the pool, if you're on the pool every day, actually depletes your iodine?
Mm-hmm. Or it kind of competes for the receptors.
Can you OD on iodine?
Yes, you can.
What is too much?
You definitely can. It really depends. You start with the 150 mcgs. Okay. You start with that every day. Mm-hmm. Mm-hmm. And then testing it you test it first, and then testing it every 3 to 6 months.
And how do you test it?
Oh, you test it in the urine. You do a special test. There's a urinary test for.
Can you go to the drugstore and buy the test? Like
Ye-
the strip, or does it, you have to have it done?
I actually do not know. You may be able to get it online from some pharmacies, or you can get it done with your doctor, or have your doctor prescribe that. Or yeah, definitely. The other part is think about seaweed. There are a few herbs that are really powerful for the thyroid. And actually, if you think about the thyroid, what happens so often, so many people get Hashimoto's or thyroiditis, which is an autoimmune problem where antibodies get created against the thyroid and start attacking the thyroid and depleting the production of hormones. And it's on the rise. And there are two possible causes. One of them that is proven, and there's research done, and that is gluten intolerance. Because antibodies against gluten that get produced in the gut, they then can travel in the whole system via blood, and because gluten is so similar to a lot of our tissue, the antibodies then will attack, let's say, the thyroid, or the brain cells, or the muscles, or the liver. So that's one. So the first thing is, for anybody who has thyroid antibodies, would be just take a break on gluten. I mean, it's the best thing you can do. Okay. The second one is because of all the toxins that have been introduced into our environment. The thyroid cells are possibly changing. What happens, the toxins get absorbed in the cells, and the cells cannot release it as easily. So instead of the cell looking like a pretty round cell, happy thyroid cell, it gets toxins in it, and it kind of gets a little off looking. So again, the body starts perceiving it as, ooh, there's a foreign invader. There's something wrong with my thyroid, something I have to get rid of. So it starts producing antibodies against it, and starts attacking it. So again, a big piece will be, how can we decrease the amount of toxins coming in and increase the elimination of the toxins? And I'll take a little break here, because the endocrine system, again, the nervous system is number one, and then the endocrine system is number two, that gets the most affected by the environmental toxins. And it is not talked about enough. And and I know I've talked about it many times, but it has to be talked about, because chemicals are such powerful hormonal disruptors. They create that, if we could really boil it down, we could see that so many symptoms that so many people are experiencing are due to these chemical disruptors. So if you think about in 1976, there was this toxic substance act they tried to put kind of in place, because there were already over 60,000 chemicals in our environment, and nothing happened. There was no protection, this is too much and this has to be tested. None of that happened, and today we have over 84,000 different chemicals in our environment, and it is a lot for our body to deal with. I mean, liver is going overtime all the time. Lymph system is going overtime. So we do have to be aware. I mean, the best thing to do is, okay, so I have problem with my thyroid, I have problem with my adrenals. Do I need a hormone over here? Yes, maybe temporarily or for a while we need to support them. But what can we do underneath to help to decrease the load on the whole endocrine system? Because if you think about xenoestrogens, have you heard of that? Xenoestrogens are external chemicals that act like estrogen in the body, okay? And that's for women and for men. You're going to see that a lot of men today have problems because of high estrogen. So here's what happens normally, because I was telling you the steroid hormones like the estrogen and testosterone, they're very potent, right? And they do work differently than thyroid. They work via a receptor. So there's a receptor, let's say, for estrogen, right? So the estrogen comes in, and then as soon as the estrogen comes in, it sends a signal like a secondary messenger. It creates another substance that sends it to the nucleus, and it starts creating whatever it needs to create. Let's say it's the growth of the uterine wall, or the breast, or the bone, or any other. Estrogen is actually a growth hormone, so it creates that. What happens as soon as the hormones sends the signal, comes off, being brought to the liver breaks it down, gets rid of it. Did what it needed to do, very potent, we don't need any more. What happens with xenoestrogens, they are so much more potent and the body cannot regulate them. So two things happen. one of them is that because this hormone is so potent, we don't want it to be running around in the body all the time in active form. When it's in the blood, it's attached to a binding globulin, sex hormone binding globulin, which makes it inactive, and it can carry it through the blood until it finds the receptor and says, okay, here you go, here you do your work, and I'll pick you up and off we go, right? Xenoestrogens do not have this protection. They run around in our bloodstream 24/7, attaching to whatever receptor they want to, and staying there much longer than the body would normally want. So it creates constant stimulation over and over. And what can happen with that? Lots of symptoms. So for women, especially anything that's estrogen related. So it would be polycystic ovarian. So, cysts on the ovaries. It would be endometriosis. It would be uterine fibroids. It would be fibrocystic breasts. It would actually be any kind of cancer, whether it's breast cancer, uterine cancer, even for men, types of cancers, prostate cancer or testes. So if you think about these conditions, they have been so on the rise, right? Just as has been these xenoestrogens. So it's something very important to remember that something called estrogen dominance is what's happening a lot in our society right now, and I'll go a little bit more into it. But the first part to remember is, where do we find xenoestrogens? Kind of, in a lot of places. Pesticides, herbicides, insecticides, right? So anything in our food, anything on those. So if you play golf a lot and you go, there's so many pesticides you bring it home into your house, on your carpet, on your shoes, in plastic, in household products, even in cosmetic that is not organic. So xenoestrogens, these potent hormonal disruptors, are in a lot of places. So the first thing to do, yes, we need to regulate hormones in our body, but how can we get rid of as many as possible, right? So that's number one thing. You had a question over there?
Actually,
I answered it. Yay! Psychic. All right. But that's a big piece. Always remember there's more to hormones than just the actual hormone. So since we're talking about estrogen and progesterone, are you okay if we go there for now and then come back to the adrenals? Even the men are okay with that? Because the estrogen actually plays a key part in men's metabolism as well. So I'll show you something really great. Now I'll go back to that picture over here. I didn't remember this, so I had to write it down. It's too complex. But what I want to show you is two things. Okay, so this is a really cool chart because one of them is that cholesterol, as you've heard so many of you being spoken about as the bad guy, is a good guy, because look at this. Every single hormone, whether it's progesterone, DHEA, estrogens, whether it's the estradiol, estriol, cortisol, testosterone, they come from cholesterol, right? We need cholesterol. Almost every single cell in our body knows how to make cholesterol, besides the brain, really. So this is really important to know for two reasons. When we get stressed a lot, when we are creating a lot of cortisol, which we'll get there, it's a stress hormone, we are needing more cholesterol for this pathway, right? As you're going to see, we're also using a lot of progesterone when we're in stress. Not so much estrogen, but a lot of progesterone, right? So what happens? Very often our body will try to make more cholesterol, so we'll have high cholesterol during stress. Do we want to take medication and suppress it? No. No, because we got to work with the underlying cause, right? Help the liver deal with the cholesterol and help this pathway over here. So that's very important. The other important part is, as you see, progesterone is a precursor to the cortisol, and over here, very important, testosterone can be made, as well as all the estrogens, okay? So progesterone gets actually used up a lot more in the body than estrogen. So think about two pieces already. So here we have all the xenoestrogens in the environment, acting like estrogen in our body, right? Then we have all this progesterone that is being very often depleted because many of us live in a very stressful environment, or we don't rest as much, don't sleep as much, depleting the progesterone. Then there's a third part, especially before menopause. What happens during the cycle is, in the first part of the cycle, the estrogen goes up, right? There's ovulation, and then the pituitary plays a role. We don't have to get into that. And then the progesterone starts going up because in the second part of the cycle, something called corpus luteum is forming from the follicle. So first the follicle is making the estrogen, then that changes into corpus luteum, which starts making progesterone. So the progesterone is very high in the second phase, and then they both drop, and that's where menstruation starts, and then it starts all over. What happens toward the end or pre-menopausal, anywhere between 2 to 5 to 8 years pre-menopause, the cycles are different. The ovulation doesn't happen, so the corpus luteum doesn't form, so the progesterone the body doesn't create as much progesterone. So on top of 1 and 2, we're also not making enough progesterone toward the end of the female cycle. So what happens during menopause, right? All of a sudden, symptoms come on. Hot flashes, insomnia, irritability, just to name a few. There's actually list of, and I have the list here, it's list of 30 symptoms that could be related to menopause. But 2 pieces need to happen. Instead of rushing in and supporting or supplying estrogen and progesterone, we really have to look at what really is happening in the body. Because not only are we already overloaded on estrogen to begin with, right, because of the environment, not only is there already less progesterone, but also during the drop, when the ovaries stop functioning 100%, they still function a little bit, but they stop functioning 100%, the progesterone drops way more. It can drop up to 0, versus the estrogen usually only drops 50 to 60%. So 2 parts are important here. One is, do we really have low progesterone? So testing is important. Do we really have low progesterone and high estrogen? And if that's the case, then it may be beneficial to supply progesterone for a little bit, not the estrogen necessarily, but supply to help with the symptoms, and then help the underlying, the endocrine system to reset a little bit, and I'll show you how. Or do we actually have, at this point, enough of both, that we don't really have to supply them, but do we have way much estrogen than progesterone that's causing all the symptoms? And this is really, really, really important, because what I see all the time, you're going to find a lot of controversial, at this point, information on hormone replacement. And you probably already have found that. There's a definite yes on go bioidentical versus go synthetic. The Prempro and Provera, very strong, very different than the human body. Lots of side effects, right? So if we have to do that, whether it's estrogen or testosterone for men, or even a lot of women are on testosterone, we go bioidentical. However, there are some studies that are coming up now that here's what happened originally. So the research found that when estrogen and progesterone were supplied together as a hormone replacement, it created it was more risk of breast cancer. So then they said, okay, let's just do estrogen by itself. So then estrogen, low-dose estrogen was supplied by itself without the progesterone, and studies are coming up more so after 10 years or 15 years of women being on these hormones, that actually up to 43% more women had risk of breast cancer being on this just estrogen support. And that's a new study that was just actually spoken about in March 2012 at the American Association of Cancer Research. So we do have to be careful. And here's what I recommend. If if their symptoms are so intense and they cannot be, brought under control with herbs and supplements and some other therapies, then only short-term hormone replacement. Because the body really, we're not made, there's a reason that the ovaries decline in function at a certain time. We're not made to have, high levels of estrogen, progesterone, until we're 100 years old, right? So we need to start looking at, is this estrogen or hormone replacement therapy, has it been kind of mainstream, and has it been, oh, everybody can be on it, it has no side effects. So be careful with that a little bit. If you're on it, or if you have a doctor who says you have to be on it, there are some other ways to look at. And one of them is now you're overloaded, right? Okay, let's take a breath. All these hormones. Makes me hot. So think about we'll take a little break, because it is too much. And it's like, if you think about the topic of the endocrine system, you hear a little bit over here, you hear a little bit over there, and what is the truth, right? So the reason I'm giving you little bits and pieces of everything is because what I'm seeing in my practice is people come, like, all the thyroid hormone on board, or they have been 3 years on estrogen, progesterone, testosterone, and while they had symptoms originally, then they got better, right? Because what happens is, if you are off low progesterone, high estrogen, and there are symptoms, and we put on a level of a higher dose of estrogen, progesterone on top, that is same level, it masks the symptoms underneath. It creates like, oh, we have now the same level, we're okay. Except there's all this hormone, excuse me, there's all this hormone on board now, and the body can only deal with that for so long until it gets overloaded. Because remember, not only already there was way more estrogen than we needed, creating all the symptoms, now we added extra estrogen, progesterone, and maybe testosterone. Well, remember what has to happen, the body has to break them down in the liver and get rid of them. And the liver, for the most part, already overloaded with the toxins. 2, 3, 4 years later, symptoms come back, or other symptoms come in. And I see a lot of women, it's like, oh, I want to get off of my hormones. Like, I was okay for a while, but now it's too much. So if you're doing great and you're on a low dose, wonderful, but I would still highly recommend, make sure you help the liver to break them down. Make sure you are eliminating. Okay, if you're not doing well, there are other ways. Okay, I'll talk about that and we'll take another break. Because what happens, if you think about the pituitary here, it works with the ovaries, right? So the pituitary is sending, you've all heard of the famous FSH and LH, those are gonadotropins. So the pituitary regulates the ovaries. At a certain point, the ovaries just stop producing enough. So these guys go up a little bit because they're saying, produce more, but the ovaries are like, no, it's out of time. We're gonna rest for now, right? So what needs to happen at that point, the adrenal gland normally comes in and takes over, right? We're not meant to, at age 35 or 55 or 65, all of a sudden go, okay, now I don't have any energy and I can't sleep and I have hot flashes, right? Why would the body want to do that? I mean, we're supposed to live, I don't know how long, but at least 100, right? So for the rest of the 50 years, we want to be feeling well. So the body is made to take over. So the adrenal glands, this beautiful triangle glands, they're on top of our kidneys. Not only are there, the stress glands and all that, they have different sections. And one of the sections produces those hormones that the ovaries produce. Produces estrogen, produces progesterone, and testosterone, right? So when the ovaries go to sleep, the adrenals are supposed to say, hey, I got it, right? I'm taking over. Except, what has happened in our world with the adrenal glands? They're exhausted, right? Why are they exhausted? Do you know that the studies show, the American Association of Medicine shows that 90% cause of all illnesses is stress? Have you heard that? We find cure for stress and we're rich. All the illnesses are gone, right? So yes, the adrenals are depleted at that point. So instead of saying, okay, I'm going to send the estrogen, the testosterone out, they're like, no, can't do, right? So that's one part. And then the other part that I'm seeing, and that's kind of hard to talk about because it's hard to test, but think about the endocrine system, like I was saying, you know, the hypothalamus, the pituitary, the thyroid, the adrenals, ovaries, testes, there's the pancreas. They are connected, right? So they have to communicate together. And they communicate via these special receptors and hormones and pathways. And what happens with stress very often that I'm seeing is somehow they get kind of disconnected. Like they don't, you know, so what needs to happen over here? So if the ovaries and the pituitary stop talking too much, the pituitary and the adrenals have to start talking in a different way, right? They have to kind of take over. They have to rewire a little bit. They're so depleted and so stressed out that it doesn't happen. So part of helping the immune system is helping to work with it as a whole. So if there's a thyroid problem, we always look at the adrenals. You know, the adrenals need help. If there is an ovarian, anything, you know, high, whether it's hot flashes or endometriosis or anything, we always look at the adrenal glands and we always look at the pituitary. We have to kind of help them connect. Homeopathy does it very well. There's some great homeopathic remedies that help to kind of wake up the receptors on the glands, help them connect. It's like, okay, here we are again. Here we are working together again. So there's so much more about estrogen and progesterone and testosterone. So do you have any questions about anything, what to test? Yes?
Actually, I have a couple questions. One question is, with the prevalence of toxins everywhere, one of the things I find is I do a cleanse, and it's great. I get great results, and I feel much better. And it almost seems like 5 days later I have to cleanse again. I mean, even last summer, a year ago, I was for 3 months doing this deep cleanse, only raw vegetables, grass juice, and all that. And I lost 17 pounds, and I felt great, and I was on top of the world. And it was like less than 6 months later, I was toxic again. And I eat well. I eat everything organic. I grow my own sprouts.
Oh, wow.
Yeah.
Grows their own sprouts, if you haven't heard.
My own sprouts. Everything in my house is like chemical free. I don't even eat out in restaurants because I don't trust.
Oh, you need to come and do a little speech here, how to do that. Because that's really how we want to do it. Yeah.
And even with all of that, I still feel like I kind of need to cleanse more. It's like ridiculous that there's. It just seems to me like it shouldn't be this way.
So few things may be happening, right? So first of all, I'll kind of elaborate on your question, if I may.
Yeah.
The part with helping the body to heal is always thinking about how can we supply what the body needs to heal, because our body truly is made, it knows how to heal. Like I was just today, I had a patient, you know, she came in and she was doing okay, and then she kind of got off on her diet and she was very down. It's like, how did she call it? She has these beautiful, she's like, I feel like crapshoot. You know, it's like, I'm not going anywhere, right? Because I'm better and then I get worse. And there's this piece that we came to is this hatred for the body because the body betrayed her, right? And it was kind of somehow the food betrayed her, yet the food was the source of love. Like when I feel down, I go for the comfort food. So it was like this disconnect, and I talked to her about, and it was just so beautiful because somehow she got it, you know, in the midst of her, she called crapshoot, which I was like, explain, I don't even know what that feels like, but she's like, I feel so bad. And in the midst of it, you know, we have 60 trillion cells in our bodies, right? Can you even imagine how many that is? And the prime directive of all these cells is to thrive. right? Is to, as she put it, to succeed. So you're telling me that all my cells are wanting to succeed. I'm like, yes, they are, right? And they're doing whatever they can with whatever they get. Whether it's the nutrients we give them, whether it's the toxins that come in, whether it's the thoughts that we have that remember the hypothalamus. When you think a thought, oh, I'm such a bad person, it creates chemical reaction in our body, goes into the cells, and it tells the cell to slow down, shut down, stagnate, rather than, ooh, I'm a good person, right? So all of this plays a role. And the reason I'm saying that, to kind of give you an idea, that all of our cells are trying their best all the time. And really, they are programmed to rebuild, survive. Some of them do die after a certain amount of time, but there are new ones coming on. It's the life cycle. So think about it. Every time we introduce nutrients and support and vitamins that our body lacks, right, into the body, it will take it and it will start thriving. And every time we take a toxin and we remove it, whether it's we start using organic food only, or we at least use the top 12 most dirty foods and we give them organic, or cosmetic, right, or anything that actually has toxins coming through our skin, you know, anything like plugins, anything smell-wise with chemicals that's coming in through the air or through our food or water, we get rid of that. The body will be like, yay, I have more energy to go over here and repair this. You know, Max Gerson, who is a very famous doctor that created the Gerson Institute for treating and healing cancer, he said the body doesn't heal selectively. You know, it doesn't go over here and heal your hypothyroid, right? Or it doesn't go over there and heals your broken foot. It heals everything. When the body heals, it heals everything. So the reason the body is not healing is because some things are not in place. Whether systems are not communicating, whether, like for you, you're doing all the right things. Maybe there's some pathways blocked from the past, right? Whether it's, if you were at the liver lecture, you know, there are all these pathways in the liver that has to be open and functioning, even just for our own estrogen to leave, right? It doesn't even have to be external estrogen. Our own body has to break down our own estrogen, get rid of it. So pathway could be blocked, just that. So opening that pathway could just, you know, be the answer for you. And certain symptoms would tell you. Or you may be allergic to certain food that when you introduce your regular diet, that food just creates a lot of reaction in your gut, and that creates inflammation and affects the whole body. There are many answers, but every time you feel like I'm doing so great, I'm doing, you know, putting the nutrients in, getting the toxins out, my body is doing better, which is good. And then you introduce something new, or you go back to your old ways, and you don't feel so good. And you have to be like, what's different? Have I introduced one thing, you know? Almonds, could be, I don't know. So that's something to look at, okay? So I want you to all take a breath. And I want you to feel your 60 trillion cells. And if you don't know how, just like my patient was like, how do I feel my body? You know, because we're so disconnected from our body, right? Just kind of put your hand on your belly and just start breathing into your belly. You can even imagine there's a ball inside your belly that increases with your inhale and decreases with your exhale. You can even give it a color. And already there, you connected with your body more instead of just being in your mind. And I would like you to imagine, when you don't even know how many that is, if you do great, 60 trillion cells, like every single cell in your body loves you. Every single cell in your body is there for your good, right? It's not there to betray you. It's not there to make you sick. It's not there to make you suffer and say, oh, I'm going to make you not sleep and feel crappy in the morning. No, none of that. All the cells are there to support us. And I would like you to just get in touch with that for a little bit. kind of feel them all smiling at you. Just like we're here, whether you love us or hate us, we're here and we're sending you love. And it always has been like that, and it always will be. No matter what you do. Can you feel that a little bit? Okay. She does? What is that? Oh, really? Oh, I love that song. Because you know, when I was talking to her today about it, and she was in such a bad place, there was like the moment where when I was talking to her, it wasn't about the words. And as you know, I'm talking to you all these words and they're overwhelming, but some part of you is remembering what it needs to. You know, some part of you will, oh, okay, next time I go, I need to test this. So don't worry about what you don't remember. But it's like energetically, something happened there in the moment. And she was actually wearing a very similar necklace as you are. It's almost like she felt the truth of it. It wasn't even like I made it up. It was like, really? Wow. It's something, oh, it's the truth. I can't deny that. My cells, you mean they want to succeed? It's like, oh, wow. You know, it was the truth, right? So really, whether you're up and down, you know, where you're struggling, it's like it is important to remember that the truth is that our body wants us to succeed, right? And if it's not, if we're struggling, it's because some things are not in place. And in that case, I'll ask you to, instead of just going thyroid over here and hormones over here and liver over here, just start seeing somebody or talking to somebody who can connect the dots for you and help the body to, it's like, okay, we work as a whole, right? So with that said, with the 60 trillion cells on our side, I want to go to the adrenal glands, if you can give me a few more minutes for that, okay? I know, it's a deep sigh. So that's where the famous cortisol comes in. Yeah. So we have heard about cortisol, and we have heard about cortisol as being the bad guy, kind of, right? For the most part. Like too much cortisol. Yeah. So these amazing adrenal glands, they have many functions, really. It's not just about cortisol. But there are two parts to the adrenal glands. There's the medulla that's inside. And that one produces the adrenaline, noradrenaline. That's the epinephrine, norepinephrine. That's the fast stress response, right? So if I go and I startle you, you're like, so that's where the adrenaline, noradrenaline comes in, and we're ready to fight and flee, right? Fight or flight response. So that has been a very good response when we needed it, and long time ago when animals were, you know, when we're in danger. It's not such a good response now, but we still have it. Right? So that's the one part, that's the fast stress response. So let's say if you get startled here and there, adrenaline goes up, then you're like, oh, okay, I'm safe. It goes down, you're good, right? But the way we live, you know, we wake up and a screaming alarm wakes us up 5 a.m., right? And then we go, start thinking, okay, I have to be at work. Oh, here's my coffee, you know, so anything stimulates, wakes up your adrenals, like that, right? Then we go into the traffic and we're thinking about stuff, and it's like, it's a constant bombarding. We don't even realize it, really. And it's not, you know, good or bad, it's just, it's what it is. But it's a constant bombardment when we don't even pay attention. Our body has to be kind of on guard, right? So with that chronic stress, that's where the cortisol comes in, right? Cortisol is a very good hormone when we need it. Because when we are sick, or when we have inflammation, or when we are starving or don't have enough food for the day, you know, so at the end of the day, or maybe for 2 days we don't have enough food, the body's like, oh, we need some help. I'm going to send out cortisol, because we need the cortisol to actually help the body to create the blood sugar and be safe, right? Except when it's happening all the time, that creates a chronic stress response. And that is where a lot of the 90% of the illness comes in, right? Because chronic stress response is part of, it creates like that chronic underlying inflammation in the whole system, especially in the gut. But inflammation, as you know, it's good when we need it and when we need fast healing. When we cut ourselves, inflammation comes in, all healed, good. But when it's chronic in our body, it actually can create a lot of symptoms. It can create insomnia, headache, a lot of weight gain. High cortisol can actually be at lots of allergies, lots of pain, muscle aches, joint pains. Cortisol could be a big piece of that. And not even going into the anxiety, depression, loss of concentration, feeling a little bit off, foggy, all of that. So, how do we test for that, right? A lot of times if you go to a doctor, they'll go, okay, we'll just draw a level, check your cortisol in your blood. 10 a.m., 8 a.m., 4 p.m., doesn't matter, right? Mostly they do in the morning. That is not enough, okay? There's something called a circadian rhythm for cortisol where it kind of starts going up in the morning, and it goes beautifully down right before we go to sleep, right? Because we don't want high cortisol at night. So how do we find out what's going on? We need to check at least 4 different times. 1, 2, 3, and 4. So the best test for cortisol, and you can ask, even a medical doctor, I believe at this point will do it, is a saliva test. You could probably order that online, or let me know. It's an easy test to do. You just go and you do 4 samples of your saliva, and it will give you a beautiful graph of where your cortisol is, right? If you're right where you need to be, great. 2 scenarios usually happen. Either so low because we're so depleted already, right? So we're tired, cannot get up, kind of don't want to have breakfast in the morning. That sort of our body cannot even wake up. So very often people skip breakfast, which makes it worse. That's like or they just get coffee, right? Because need something to wake up, but I don't want to eat. So that is the low adrenals and makes it even worse. Or there's one where the adrenals are low, but then the cortisol goes up at night, right? That's where the insomnia comes in. That stress insomnia where we cannot fall asleep. So it's either the liver is overloaded or too high of a cortisol, or both, because they're connected, right? And remember, here's where the thyroid comes in, because when the thyroid is off, it affects the liver, it affects the cholesterol, and it affects the adrenals as well. So we always look at all of them. So remember, testing the circadian rhythm of the cortisol. Every hormone really has its own rhythm, but it's very important for the cortisol because that's a crucial part. So what do we do if we have high cortisol? It's not easy to bring down cortisol, besides, de-stress yourself. How do you do that? But that's a good thing to work on. Meditation, bath, all that. But there are one herb that's called holy basil. I put it down for you. And it's very good for bringing down cortisol levels, especially you take it at night. So holy basil is a beautiful herb. And then the other one is phosphatidylserine, which is a supplement that can really help to bring down the cortisol when it's high. It's in the notes. It's phosphatidylserine. Oh, it's not in the notes. Sorry about that. You probably can't see that. Phosphatidylserine, phosphatidyl, and then serine. Serine, phosphatidylserine. You can't probably read that, so I'll write it again on another page. But isophos. Seraphos may have that in it too. I'm not familiar. Yeah. Phosphatidylcholine and phosphatidylserine often comes together in a supplement. They really help the nervous system because they're a precursor to the neurons, but they also really help with the cortisol. So that's a good one. So that's for the high cortisol. Then for the low cortisol, very often what you're going to see is if you go to a naturopathic doctor, sometimes they actually put you on something called Isocort, which is actual cortisol. So before you do that, which is very strong way to support your adrenals, it's like, you know, pushing them. There are other supplements called glandulars, which if you haven't heard of, they're made from glands, mostly bovine gland. And what that does is it supplies some of the hormone, okay, and it also supplies all the nutrients that the gland need, and it's called philic. It's because it's the gland. It's when we take it, the gland absorbs it really fast. Like it's let's say adrenophilic. It wants to go to the adrenal gland, and there are a lot of them out there. One of them I really like is this adrenal complex. So just so you know, before you go on anything strong, there are other ways. So here is your cortisol hormone, which really is, for the most part, too strong. Over here, still strong, but a little bit less, is you can do the glandular. Or you can just start with some powerful herbs. They're called adaptogens. So some of them are the ashwagandha, the maca, the rhodiola, as you have in your notes, the ginseng. Do know, though, ginseng there's American ginseng, which is very stimulating, right? And then there's Siberian ginseng, which is more of an adaptogen and helps gently wake up the adrenal gland. The one supplement that I love a lot is from Gaia. You can find that at any health food store. Has most of these herbs in it. It's adrenal support. Again, it's hard. You know, I don't want you to go and get all of this just because you think you may have low thyroid. Always get it tested, or low adrenal, get it tested, get it checked. But there are other ways to do this than just the hormone. So just so you know that. The other very, very basic pieces, which we keep forgetting, is thyroid needs vitamins and minerals, especially the iodine we talked about, but also zinc and selenium, just some basic minerals. Adrenals, they need about 70 different trace minerals. They usually come, and I don't have the bottle here, I think Charles has it. There's a beautiful bottle of the trace minerals, yeah? So there's just a basic support. But then we're depleted, right? So what do we need? We need some stronger, so-called. So we need a really good multivitamin from a good organic source, just like Charles has here for men and for women, right? Very important to supply the nutrients. The other one is B complex. Adrenal glands, they need a lot of energy, and they get a lot of energy by creating different molecules, and in between those molecules, B1, B2, B5 comes in and helps the reaction, right? So B complex. And the famous magnesium. I always talk about the magnesium as the forgotten mineral because our body really needs it. And we always talk calcium, calcium, but we need a lot of magnesium as well. So remember, it's the magnesium, it's the B complex, and the multivitamins. And always, you know, people ask me, can I get my multivitamin anywhere? You know, I see that Costco, Walgreens. You pay for the quality of your multivitamin, or your fish oil, or anything, right? So just like you will pay for organic food, you want to pay for a good, made from whole food, organic multivitamin if you're taking it, okay? So with that said, how are you guys doing? Yes, go ahead, go ahead.
For example, I'm taking thyroid.
Uh-huh.
So, but I'm also taking almost all the things here that you
Nice.
but so does that affect the lab results? I mean, is it given a false number?
Which part? Because you're taking the supplements?
Yeah.
No.
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 It won't, so
You mean like the thyroid supplements?
yes. You know,
The herbs and
iodine, the selenium, the zinc, the
ashwagandha. Ashwagandha is great. Yeah. No. So if you were gonna test iodine and you take iodine, it will affect it, right? But if you're just testing thyroid and you take zinc and selenium, no, it will only affect it for the better. Like, let's say it may show you need less hormone because your body is producing more of your own. Does that kind of make sense what I just said?
If it's not, it's really not producing it.
Any?
I'm taking all these supplements.
Mhm.
So does it give a false number?
It doesn't. No. So the answer, it doesn't.
You know, should I not take them before I go have my blood test?
you're fine. Like on the day of your blood test, you don't take any hormone anyhow, right? So don't take anything. It's always best to go first thing in the morning. But if you take it the day before or the week before, it won't affect it. You're okay with that? You're welcome.
You're saying different for adrenal support. Taking bovine stuff always just creeps me
Yeah, I know. A lot of people do. Yeah, so that's where I really love the herbs. It's always, you know, herbs are so amazing. Like in naturopathic medicine, if you see a naturopathic doctor, what is so beautiful about there's so many options, right? And very often, our body, gosh, I'm on a creative streak over here. Our body is so overloaded. So what I always like to do is there are categories, right? So we start with the homeopathy over here. This more of a subtle, kind of like gentle push, but yet very powerful, right? Then we go to the herbs. Again, very natural, very, you know, the herbs, what is beautiful about herbs is instead of taking one part out, instead of taking the magnesium out or the phosphatidylserine out, right, the herb has many constituents and they stay in the herb and they work together. That's why ashwagandha or maca you're going to see, they work for the adrenals. They work for libido. They work for the ovaries. They help the thyroid, right? It's because the herb is so complex and it works together. Then you go to the supplements. So here's where you get in the vitamin A, the vitamin C, the phosphatidylserine, right? And then you go, so let's say for the adrenals, we would do the B complex, right? And then you go into, okay, so do we need something stronger? So here you would do the glandulars, something like closer. That's not enough, then the hormones, and then over here like the drugs, right? So we want to stay as close as here as possible. And here's what sometimes I see. Let's say the adrenal gland is so depleted, you know, I think, oh, okay, I need to do something strong, right, to wake it up. But at that point, the adrenal gland is so depleted that it actually cannot even absorb this. It's like too strong almost, and it doesn't know what to do with it. So very often if, you know, you get put on something strong, whether it's a hormone or a glandular, and it's a strong supplement, and it should be doing something and it's not, it's because very often the receptors, the gland is so confused in a way, if you want to put it that way. So we need to gently wake up the receptors, say, okay, let me help you gently, and then move this way more. And then, if we still need this, it's going to work better. So there are definitely other ways to answer your questions. The herbs, I love the herbs, especially for the adrenals. But sometimes, like for the thyroid, what I have seen, even with Hashimoto's, you know, in so many women especially women, I mean, it's prevalent in men also, but mostly in women. I have women that can get off of their hormone because what they do, they take a glandular, right? So what the glandular does, not only does it help to decrease the antibodies, if there are any, but it helps to go into that kind of a little bit broken cell, right? And it brings in the nutrients, and it brings in the right signals, and it helps the cell to heal again. So it looks like this. So when the cell looks like this again, first the antibodies don't need to be produced anymore, right? And then the cell can produce its own hormone more. So in a way, the glandular comes in, and while it's supplying some hormone for a little bit, it's rebuilding the gland. So then the gland can then do what it knows to do, and then it's to make its own hormone. And it's really important. Because when we get hormone on board, whether it's thyroid, whether it's cortisol, whether it's any other hormone, so what does it do, right? It shuts down, remember, the hormone that's from the outside, the T4. It shuts down the pituitary up here, says, we're plenty, don't make more. So the pituitary doesn't go and doesn't stimulate the thyroid to make the hormones, so the thyroid kind of goes to sleep a little bit, right? The cycle slows down a little bit because it's dependent on this hormone. So very often people come and say, I had my thyroid irradiated, or this is not working, I need to be on the hormone. But very often, the thyroid is just sleeping. Even with the radiation, when we wake it up, it starts producing its own hormone. So there's always a way to look at it a little bit differently. Same thing with the adrenal glands, which is very important, and we don't talk about. You know, sometimes for some illnesses, people get put on steroids a lot. Have you heard that? Steroid hormone, just to shut down the response, you know, just help, whether it's skin condition or any inflammatory condition or autoimmune condition. Well, what does it do? High cortisol, right? Again, tells the pituitary there's a hormone called ACTH, adrenocorticotropin, which tells the thyroid, the adrenal, just like the thyroid, to make hormone, to make cortisol, right? So when we put all this cortisol on board, we shut down the cycle and we actually put the adrenal gland asleep. What's unfortunate about that, and I have seen it actually many times, not only when we then stop the cortisol, right, or the steroid, which is some form of corticosteroid, when we stop it, a lot of fatigue comes in, a lot of low adrenal symptoms come in, but also infections can come in because cortisol in a low amount is really important to help the immune system, right? When we shut it down, the immune system actually gets shut down with it a little bit. So it's very important if you ever need to be on steroids, and again, there's always many other ways to do that than having to be on steroids, but then help the adrenal to wake up right after, because it's kind of in that shutdown place.
Would it wake up by itself after a period of time?
It depends. It can. But if there's a lot of overload, if there's a lot of non-nutritious food on board, it kind of tends to stay asleep.
So would that be either the adrenals asleep or exhausted at that point because of the high dose of the
It depending where it was before. If it was exhausted before, it's going to stay exhausted and asleep. If it was okay before, then it's just going to be kind of shut down, asleep. Mm-hmm. Yeah. Mm-hmm.
Does that apply too if you're using a steroid cream for a skin rash or something?
Not as much because it's not as potent, but it does absorb. Remember, anything you put on your skin does absorb. So yeah, it will absorb a little bit in. But it won't, because it's not as strong, it won't necessarily shut down the thyroid. Okay, so the final piece on the adrenal glands is allergies. You probably heard me already talk about that. Would you think that having allergies, runny nose, runny eyes, itchy eyes, hay fever, even eczema, it could be related to low adrenals or weakened adrenals? It actually can, yeah, because there is the histamine response with the allergies and the cortisol, they play a role. So that's why I like these guys a lot. If you have allergies, this company called BioAlert. You've probably seen that. They have, for any type of allergies, really they have a formula, but what they do is they make sure they support the adrenal with something called adrenalinum, which is right here. It's a homeopathic for the adrenal, so it wakes it up. It really helps you strengthen it in that deeper level. So remember, allergies are very often connected to low adrenal glands, besides being connected to the gut and the food we eat, but I won't even go there because it's a lot.
Is Charles going to carry that?
This is, you can find, these guys that Charles carry are special, and you cannot find those at a health food store. They're doctors only. That's why he carries them, because, so people can get it here. They don't have to go to a doctor. But these guys you can get Sprouts, Whole Foods, even online. Yeah, if you need them. Beautiful. So what I would like to do is say hello to ourselves one more time before we go, because I really want you to remember that. And especially with the endocrine system, think about how connected it is. And we just touched like a little tip of the iceberg, right? But I hope you already will remember that maybe there's a little bit more to my thyroid and a little bit more to my adrenals and some more to my estrogen, progesterone, testosterone. So I just wanted to say hello to yourselves again. And do remember that your body works as a whole. It works energetically. It's not only the hormones, and it's not only the nervous system signals. It's not only the vitamins and the fruits. It's the thoughts and it's the energy. And every time you can remember that your cells are for you, that your body is for you, and it really is wanting to succeed and wanting you to succeed, it does make a difference. Because it does feel like a truth, right? I mean, right? Instead of the opposite, like, oh, my body is betraying me. What? They do, and they actually do. Like right now, all of my 60 trillion cells are doing everything they need to do while I am talking and thinking, and they don't even, they're just doing their work, supporting me, right? Thank you. So no, really, just maybe if you feel comfortable, close your eyes for a little bit. And if you know how to connect your body, remember that we're so much in our mind, and it's, we're so often disconnected from our body. So just have a way of like dropping, like you almost like imagine there's a ball of light in the center of your head, and you just drop it down like the ball on New Year's Eve. You drop it down to the core, to your lower abdomen. And then take a breath and just feel your body. Feel your feet touching the floor. Feel the chair supporting you. Feel if there's any tension anywhere or flow someplace else. Just really get connected to your body. And as you feel your body, feel the cells just working, talking to each other, doing their work. We don't have to tell them. They know what to do. They know how to support us. And they do love us. So as you're feeling the love from your cells, I would like you to send some back. And just as they're smiling at you, just smile back at them. And you can even actually smile and create a smile on your face. Because what that will do is that will go into your hypothalamus and send signals to your whole body of a beautiful relaxation and nourishment and good feeling. Just whatever you need to remember from today, know that you will remember. You can always ask questions. There are always resources, so don't worry if you missed anything. Just remember the key piece is our body works as a whole, and it's here to support us. It's here for us. And then you can take a couple deep breaths. And you can believe it, you don't have to, but just know the body is here to support me, period. Even though I sometimes don't feel so good, it's here to support me. So what I would like to do is in the next 5 minutes is if you have any questions, let me know, because I know some of the topics were a little bit fast, and I know sometimes the hormones are a bit more of a question. But I do want to tell you is on the notes, so this will be our last class for the year. We'll resume in a form next year, but it's so much going on before the holiday, so we'll postpone it. But I do want to tell you that you still have an opportunity up until after Thanksgiving. The cleanse that I created by really kind of seeing what my patients need and what's best for the liver, colon, that you can purchase for actually a discounted price till Thanksgiving. Okay, so it's 4 supplements. If you have questions about it, a lot of people that are here have done it. They had great results. I have done it myself. It's kind of that doing something to help the body to clean the extra toxins and learning for a lifetime what to do, not just for 3 weeks. It's a 21-day cleanse, but doing it, something that you can do for the lifetime to actually help your body. So you do get $55 off if you decide to sign up today. If you have questions, let me know. But no, it's always available, but you do get a discount. So questions, let me know. I want you to know that there are a lot of ways you can help your body. You can cleanse. This is one of them. I love it. I stand by it because it has helped so many people that I have worked with. So thank you so much for being here. So appreciate that. Thank you.